Good morning, Dr. Jacob. I'm Dr. Kishore. I'm one of the pediatricians and I'm one of your favorite followers.
Wow.
My favorite followers, or I'm one of your favorite leaders. Either way, doesn't matter. Favoritism is not good.
Dr. Sean, I think we are loud and clear. I think your voice clarity is absolutely fine with your earphones as well.
All right, rolling the video.
Yeah, thanks, Shivali.
In the contemporary world, yesterday is history and tomorrow is full of opportunity. Innovation, transformation, and optimization are the future of industries to achieve excellence in business. Intellect Bizware is a leader in innovation technology and a subsidiary of Neelant Limited. We use a human-centered approach for problem-solving and change management. With more than 14 years of experience in helping companies digitally transform by adopting global best practices and building next practices in industries such as consumer goods, retail, discrete manufacturing, chemical and life sciences, our solutions help streamline sales, HR, customer, vendor, and employee engagement. We offer pre-configured SAP solutions that drives industry-leading best practices to your business and help you start using in weeks rather than months. We have always been the front runner in driving the SAP innovations. Intellect Bizware has grown to over 400 SAP professionals and more than 200 happy clients across industries. These numbers are rapidly increasing. In our journey, we have seen the following milestones: served the first customer overseas in 2009, won the first Fortune 500 client deal in 2011, served our 100th customer and won Top 3 Techno-Savvy SME at the Emerging India Awards 2013, become a subsidiary of Neelant and received the award for EBM Partner of the Year by SAP India in 2015. Worked at pioneer level on S/4HANA with one of the world's first few S/4HANA conversions in 2016. Won the SAP APJ Partner Excellence Award in 2017. In 2018, we qualified the highest number of SAP qualified partner packages on SAP S/4HANA. In 2019, we served our 200th customer. In 2020, we were the SAP S/4HANA Cloud Partner of the Year. Get in touch with us today to embark on a digital transformation journey.
It's been more than a year since the COVID-19 outbreak. The pandemic has created an unprecedented global health crisis. It's time to look back on how our healthcare and life sciences coped with the uncertain times. It's also time to look at the future. It is time to recalibrate. It's time to act. Health of India is a series of high-profile power-packed virtual summits bringing together more than 50 speakers from across India. Throughout these summits, health ministers, policymakers, top CEOs, thought leaders, and technologists will initiate a new dialogue with focus on innovation, technology, and policymaking. Join the conversation as we respond to, recover from, and reimagine the future beyond the current global health crisis. Health of India, time to reimagine the future.
Wonderful. Thank you so much, Shivali, for playing in that video. And good morning to all present here, all our speakers, all our participants, all our guests present here. Thank you so much for joining. I know it's not easy to come online anymore. It's been 2 years that we've been doing online. So on behalf of Team Data Leads, Health Analytics Asia, and our partners, SAP and Intellect I welcome everyone here for the Health of India Karnataka edition series. Thank you so much for joining in. Like all other webinars and online sessions and conferences, this one too, sadly, is going to be online. I just wish that, we could have done this offline, like we were just discussing in a traditional mode where, I think Mr. Sabaha just said that let's do sound check 1, 2, 3. We could have done that in person. Bangalore being our favorite place, we've been there like a number of times, done all our conferences, our boot camps, our summits right there in Bangalore. So we miss you all being there, but hopefully, and COVID permitting, we would be soon there, and next one we would do in Bangalore, seeing you all in person. Like all of us in the last couple of years have witnessed the worst crisis of the century, a crisis which has taken away our near and dear ones and also caused huge loss to livelihood. It's almost 2 years into the pandemic now. And it's now actually the time to take stock of how healthcare and life sciences have managed to cope up with such stress, and also discuss the strategies that have been developed to address those small gaps, in fact, big gaps also, and vulnerabilities that we witnessed during the COVID-19 pandemic for the last 2 years. The pandemic has created an unprecedented situation and a very, very uncertain time in global health. But it has also at the same time created an opportunity for all future partnerships and collaborations to fight all those small gaps and vulnerabilities that we had witnessed. Like our tagline for the entire series goes, it's time to reimagine the future, and the time to act is right now. On that note, give me a moment to start the session today and share my screen. All right, so my name is Surabhi Pandit Nangian. I'm the Director, Outreach and Partnership with Data Leads, and we work from New Delhi. On behalf of Team Data Leads, Health Analytics Asia, SAP and Intellect Businessware, it's completely our honor and pleasure to have everyone here with us today. So what is the objective of this series and why are we here? The objective of this initiative is to build a committed platform for strategic collaboration in the ever-evolving areas of health and life sciences. This series will feature health ministers, policymakers, CEOs, thought leaders, technologists, and journalists as participants in high-level deliberation on health with focus on innovation, technology, and policy making. Spread over 8 states. We've done already the third one. The series will highlight pivotal perspectives of the states that drive India forward and promising to shape the country's healthcare and life sciences ecosystem in the years to come, and so that we don't face the problems and the issues that we faced in the last couple of years. I will take a moment to tell everybody about what Data Leads is. Data Leads, our company, our parent company based in New Delhi, is a digital media and an information company aimed to help people understand and engage in the world around them. We also work with the world's leading media and tech companies and health companies and regularly partner with them in various collaborative ventures. Our work spectrum actually ranges from and includes capacity building initiative, fact-checking initiatives, media research, data-driven content, and events with a special focus on building collaborations in public health. We're also the proud partners of Google News Initiative and Into News in India in launching pioneering information literacy and fact-checking initiatives, which has benefited over 1,100 newsrooms and organizations, 700 plus universities in over 12, 13 languages across India. And we are really, really proud of the work that we have done in the last 3 years on fact-checking. So that's our agenda, keeping in consideration the extreme fatigue all of us have faced because of the online sessions. I know it's when we started doing online sessions, we thought it's going to be nice, we just have to just come up on the camera and nice. No, but I think Anna would also agree that online is not easy. It's definitely not easy. So there's a lot of fatigue that's happening. So we're going to keep this session as crisp and short and as focused as possible. After the introduction session in a minute, we will start with the keynote address. This will be followed by a panel discussion on reimagining the future of health. After that, we will just take a 5-minute poll survey and then start with the flash talk session. We will end by 12 o'clock. So we're trying to keep it as crisp as possible. With that, my honor to invite Dr. T. Jacob John as our keynote today. I would want to take this opportunity to introduce him. Of course, he needs no introduction and he's known to everybody, but I would still want to say a few words about Dr. John. Dr. John is an eminent virologist and former head of Center for Advanced Research in Virology, ICMR. He established India's first diagnostic virology laboratory and conducted pioneering research on infectious diseases, clinical virology, vaccinology, and epidemiology. He detected high risk of post-transfusion hepatitis B in 1972. He established a retrovirus laboratory and field unit, and in 1986, he was the first person to identify individuals with HIV infection in India, and he documented the first vaccine failure polio cases. His model of polio control became actually the forerunner of global polio eradication. He has chaired India's expert advisory group on polio eradication and co-chaired National Technical Advisory Group on immunization with the Government of India, among other advisory roles. So thank you so much, Dr. John, for joining us today. With that, it's over to you, Dr. John. You're on mute, Dr. John.
How about that?
Wonderful. We're all good.
Okay. That mute came automatically. I didn't do it.
Okay.
Anyway.
No problem.
Okay.
Thank you so much, Dr. John. Yes.
Yeah. S1 Syed, S2 Surbhi, S3 Shivali, and my favorite pediatrician colleague Kishore, and my dear friends. I think I can call you all friends.
Yes.
I have titled my talk as Imagining the Future of Health Management in India. Mind you, this is not healthcare management. This is about health management. Every culture has evolved its own concepts of health and disease. Our own ancient culture has its own understanding and dogmas about origins and causation of sicknesses and how to stay healthy. Experience provided evidence. Random probability distribution was not factored in. In a nutshell, health is personally achieved. Illness is the result of some action of omission or commission that upset the internal balance of three factors called three dosha. When their equilibrium is upset, we become ill. The fundamental basis of that was that physical causes for physical illnesses and physical therapeutics for remedying the illnesses. This great advance rescued health and disease from a magico-mythical concept and posited them in the physical world of what we eat, what we do not eat, our personal hygiene, keeping our environment clean, our disciplined lifestyle, exercise, and if inclined, practicing yoga. The bottom line was one's health is in one's own hands. Some diseases not explained by this theory, for example, poliomyelitis, polio, called infantile paralysis, could not be attributed to the Tridosha theory. So such diseases, polio was called Bala Graha Dosha. Some diseases were attributed to karma, to God's punishment, planetary influences, and so on. The issue here I'm bringing out is the great advance in thought of India 3,000 to 4,000 years ago in bringing health and disease into the realm of the physical world, but not realizing that if you have a theory which has an anomaly, that theory has to be reworked. You cannot have Balagraha dosha in the Tridosha theory, and therefore you need to rework the theory. But if you don't want to allow somebody questioning, you convert that into dogma. You just believe it. That's where Ayurveda went wrong. Just believe it. Don't ask questions. Scientific medicine or science in medicine evolved in the European culture. They went further and borrowed tools and methodologies of physical science and mathematics and came up with microbial causation of diseases that revolutionized medicine with diagnostics, disease classification by etiology, by cause, every disease named, classified, even numbered, just like botany or zoology. Everything, every disease had a name and a number, and they were put into an international classification of disease. And that is what doctors are supposed to know. And when you make a disease diagnosis, you have to put a number according to ICD. Therapeutics had to be appropriate for the diagnosis. Antidotes, like antimicrobials, were the principle of therapeutics, which earned the nickname of allopathy. Apothecaries and barbers who provided services later on transformed into medical doctors and surgeons. Cause and effect inconsistency had to be faced, explained. So that is where mathematics and statistics came in, and random probability distribution, stochastic prevalence, etc., developed in medicine, mind you. The unexpected spin-offs of finding microbes was that microbes transmitted, as we very well know about coronavirus, human to human to human, or from animals to humans, either directly or through vehicles of contaminated food or water or insect bites. And that led to the recognition of something very fundamental: socioeconomic determinants of diseases. Cause may be one, but determinants is the milieu in which the cause becomes a true cause. Not only socio-economic or socio-cultural or political. A child born in UP and a child born in Kerala do not have the same trajectory of life and health. So socio-political determinants, and of course, environmental determinants of disease. Social regulations or restrictions to keep these determinants at bay, or interventions in the environment, doctors have no jurisdiction. State has the jurisdiction. Okay, so preventing sexually transmitted diseases, fecal oral transmitted cholera or dysentery or typhoid fever, mosquito transmitted malaria, all these only the state can prevent. So health is not in one's own hands alone. Health is also in the hands of the state. Mind you, more than 100 years ago, mosquito transmission of malaria was discovered on our soil, not by an Indian, but a European doctor, but it was here. And we still have loads of malaria. And the countries that use that information got rid of malaria. We know that information, but live with malaria. The political philosophers caught on to this, and they insisted, said the people's health has become state's responsibility. All democracies, by the way, democracy itself is a Western cultural idea emanating from the French Revolution. All democracies accepted the policy that people's health was state's responsibility. Both disease prevention through mitigating the socioeconomic and environmental disease determinants, and personalized disease care that was labor intensive, involved diagnostics and therapeutics, and just one person giving service to one person at a time. Awfully expensive. The state-managed disease prevention had to be legislated in, and that is how the public health acts came into being in all democracies, many democracies. Disease care, nicknamed as health care, had to be evidence-based and quality assured, as it had to be consistent with human rights. The medicine in this system is a contract between two individuals. Medicine in Ayurveda is a charitable social service. No accountability. So health management has three interactive and integral subsystems. Number one, public health, which is the state's wing, division or department that is concerned exclusively with the disease determinants and their mitigations. No public health person ever treats a patient. That's prohibited because they are in the disease prevention category. The second subsystem, of course, we all know is healthcare. Number three is research, biomedical research that keeps the bars raised of both public health and healthcare. So these three subsystems together make a good health management system. If you want models of public health, you look into almost any Western country. In the United States, It's a uniformed service, public health service. In the United Kingdom, it is Public Health England. It used to be called Health Protection Agency. If you want to look at how the healthcare expenses are managed, you look at UK, where the state uses the revenue, or in Canada, Germany, and many others use state-regulated, state-managed health insurance schemes. Through all these, democracies realized that healthy people create wealth. People are consumers and creators of wealth. Healthy people create more wealth than they consume. Sick people consume more than they create. So then realized that investment in public health was found to be one of the very high profit investments. Countries with public health system have less than 10 cases of tuberculosis per 100,000 or 1 lakh people per year. We who do not have that kind of a public health subsystem has 200 per lakh population. If India wants to get rid of TB, and the hope is by 2025, India will become TB free, no way, without public health, we shall never control tuberculosis. And without
sorry, Dr. John, my apologies for budging in between, but I think you'll have to.
Yeah, finished. That's my punchline is that without universal healthcare, we will not control TB. And TB is only one example of a huge number of communicable diseases. Back to Ayurveda, their belief system of internal development of disease was fully accepted by scientific medicine, and that is a non-communicable diseases. Thank you very much.
Thank you so much, Dr. John. That was wonderful. And coming from the experience that you've had in eradication of polio, I think we've had so much of insights from what you've said today. A big thanks for all your time, for joining us. And we will, of course, now start the first plenary session. And whatever questions that we have, even for Dr. John's session, we will take it up after the plenary session. So with that, I would now want to set up the stage for our first session with 5 visionaries armed with expertise ranging from healthcare to mental health to technology, who will explore the challenges and the new opportunities for the future of healthcare. The hour-long session will discuss pertinent questions about what are the key learnings from the pandemic and what are the ways to address the inequalities in access to healthcare. We will take all the question and answers in the end, devote 10 minutes for all the Q&A. With that, I'm going to introduce our first panelist today, Dr. R Kishore Kumar. Dr. Kumar is the founder, chairman, and senior neonatologist and the inspiration behind Cloud9 Group of Hospitals. His experience as a neonatologist across the world led him to spark the idea for a world-class women and child healthcare facility in India. Together with other co-founders, he set up the Cloud9 chain in 2007. Welcome to the Health of India series, Dr. Kumar. It's our pleasure to have you here with us. Our next panelist is Mr. Sabahat Qazi. Mr. Sabahat is the CEO and co-founder of Intellect Bizware Services, which is a Mumbai-based IT consulting focused on SAP services that he set up in 2007. Mr. Sabahat has helped over 200 enterprises in their digital transformation journey. He is a technophile and a practitioner of design thinking. Thank you so much, Mr. Sabahat, for being here. Our next panelist, Anna Chandi. Anna is one of India's foremost mental health professionals. Her work encompasses counseling individuals training and mentoring counselors, and leading strategic interventions which are aimed at systematic change in India's mental health ecosystem, something which is so required today. She is the founder of Anna Chandi and Associates, and also serves on the board of the Live, Love, Laugh Foundation in Bangalore. Thanks, Anna, for joining us here. Our next panelist and his introduction, Mr. Suresh Ramo. Mr. Suresh is the co-founder and CEO with SiteCare Cancer Hospitals. With over 17 years of experience, he leads Quintiles India's clinical development. He is the Asia Pacific Head of Global Data Management and Head of Operations for the Cardiac Safety business. Suresh is an alumnus of IIT Madras and IIM Calcutta. Thank you so much, Suresh, for taking out time for the Health of India series. Our next panelist, Mr. Vaibhav Tiwari. Mr. Tiwari is the co-founder and CEO with Portia Medical. Mr. Vaibhav has over 18 years of experience in building new businesses across technology and supply chain industries. And he's also an alumnus of IIT Kanpur and IIM Calcutta. He is actively involved in promoting entrepreneurship and serves on the advisory board of many startups. With that, it's over to, I would want to invite our founder, CEO, Syed Nazakat, to moderate the session. Thank you so much, everyone.
Hi, thank you so much, Survi, and welcome all. It's a very distinguished panel. And Dr. Jacob actually made our work a little easier because he put things in a perspective of his experience of decades working across India in different settings. I think of the challenge for us, of course, there's a COVID-19 is unprecedented. It has created an unprecedented global situation. We are still in the middle of it. We don't know still whether there's going to be a third wave or not, and how we will eventually emerge from this situation. But I think the other purpose of particularly of this panel is to look at the future and look beyond maybe next 1 or 2 years. And let's reimagine what kind of future we want for our people, where they will be healthy, better, and they have access to best healthcare solutions as well. So in the next 1 hour, what we're going to try to do is, we know there are a lot of problems out there, and in a country like India, 1+ billion population, and with all settings we have, we know there are immense problems at different levels, both at public health level, both at healthcare delivery and supply chain systems. But we will try to figure out what are the solutions, because we have a limited time of 50 minutes. We will focus a little bit more on solutions. And I'm really glad that we have a diverse panel on the board here who has a rich experience of working on the field with different stakeholders. And we will try, my job essentially is to be here to facilitate the discussion. I will do a first round of asking each one of you what is or has been the major healthcare challenges in the last, you can see in the last 1 or 2 years, and how do you see new opportunities for us, particularly given in your area of work? How do you see the world from that prism? And then I will break up actually into a question answer session. You're free to supplement each other, make a point to each other's intervention. So if I start with Dr. Kishore, with you actually, how do you see India's position today in a global context? Where do we stand in terms of providing good healthcare or good health solutions in India to the people? What do you see our biggest challenges moving forward? And what do you see our couple of opportunities? And if you keep it short, like a short intervention of 2 minutes.
Thank you, Syed, and thank you, Data Leads, for organizing this healthcare summit. This is being held at the right time, because the right time is to make the right noises to fix the healthcare system, especially after this pandemic. Healthcare delivery is complex, and we cannot standardize the response of a particular person to any particular medicine or a drug, unlike the IT sector. Lifestyle changes, as Dr. Jacob John mentioned, changes from one person to another person. Genetics changes from one person to another person. So what we can do and what we should do is standardize the healthcare delivery that is expected. India is like Europe being a single country with both Africa and America in one continent. So the challenges we have are primary, preventive, and public health care that needs to be available in all parts of the country. Currently, there is none of these in most parts of the country. Tertiary care is excellent in urban areas. Hardly we can boast of this in rural areas. It's only the governments who can do these. It's like infrastructure. We may have Infosys, Wipro, and various things, but if the roads, electricity, and bridges are poor, transportation is horrible, we can't do much. So the opportunities, what we have is the government should focus on PPP, not private public sector. It is primary, preventive, and public health care. We have excellent players like Cloud9 with remarkable maternal and neonatal indices, site care with oncology, use their expertise, leave politics out, identify the talents, retain them for betterment of the country. Once that is done, they can get involved in the tertiary care, where even countries like Sweden are struggling even today. So we need to strengthen the private tertiary healthcare and establish primary, preventive, and public healthcare through the country and offer incentives, and rather than using them as a competitors or criminals. So that's my brief introduction of the challenges and opportunities we have. Back to you, Syed.
Thank you so much, Dr. Kishore. Suresh, if I take the same question to you, how do you see India's position in terms of healthcare challenges we face in the country, and what do you see for the future next 1 or 2 years?
Thank you so much, Syed, and thank you, Data Leads, for this opportunity. I think I will just take off from where Dr. Kishore left. I think if you look at what has happened in the last 1.5 to 2 years, it is unplanned, unexpected, and a significant burden on healthcare due to COVID-19 on both the public and the private sectors. Enormous capex, the enhancements that had to be done in a very short period of time. Subsidies across the board, not only in health, but all sectors. A complete disruption, essentially, of the normal, so-called normal state of working. Our supply-demand gap was exposed. We always knew it. It's no surprise, and it goes back to the point Dr. Kishore was making in terms of the gap in resources needs to incentivize the public-private partnership. We need to collaborate a lot more. But everything was exposed, right? We had resource shortage in doctors, nurses, intensivists, beds in ICUs or ward beds, oxygen supply, biopharma products, supply chain, cold chain, lab diagnostic capabilities. See, across the board, we had a significant shortage. It also resulted in the social disconnectedness because we couldn't meet with people. Virtual connectivity is not the same, though it's significantly helping bridge the gap. But I think the big issue is still the ambiguity, the variability, the lack of predictability. We don't know how the next week is going to be. Which state can I travel? Which state I can't travel even within the country? Is there going to be a lockdown? What can I plan if I don't know my next week? So businesses are significantly affected in terms of decision making. And I think this is something that we all need to realize. And it might take a significant time to actually overcome this variability. On the other hand, there has been a lot of innovation. Consumer expectations have changed. The economic pressures is putting pricing pressure on healthcare delivery. A huge amount of capex has actually improved our supply and capabilities. We have a lot of people resource trained. There's a lot of awareness in every single household on healthcare. Government's focus on primary healthcare has definitely increased. And screening as a concept for COVID-19 can actually be now expanded into screening for all of the lifestyle diseases. I think we've understood it. So there is a lot that we can take away from the last 2 years.
Thank you, Suresh. Sampath, how do you look at, as a technologist, what do you think, where does India stand actually? We did great interventions with technology in the last 1 year, including if we look at even booking for COVID-19, it was a tech platform, millions of people came on board quickly. So how do you see the role the technology can play, and what are the challenges and opportunities for us?
Thanks, Syed, for inviting me to this August panel. And I second what Dr. Kishore and Suresh have said about the problems such as infrastructure and all. But I think a large part of it can also be solved by technology. It has been amply demonstrated, the CoWIN platform, for example. And there are a lot of initiatives which the government is doing, for example, centralizing the EHR, for example. While these initiatives have not really picked off, but I think if they had picked up, probably we would have been in a better situation, both in terms of dissemination of information, as well as from a data analytics perspective. Data science itself, as Dr. John also mentioned, in a way is the origin itself is probably from medicine, from experimentation, from the lines of treatment and all. And it can play an even bigger role. So we are seeing a lot of inequalities today in terms of how we are treating people or the reach, and technology is something which I feel can definitely help in this regard. Data science, even telemedicine, for example. And there are so many things where technology can actually provide that interventional tool.
Wonderful. And I'm certainly going to come back to on data and AI, the role of it maybe in the later session. But how do you see, as a mental health expert who has spent years and years working with institutions and individuals, trying to look at the impact of diseases on individual, on their psychology, on their emotional health? Where does India stand if you look at global burden of mental health, and how are we going to deal with it, and what are the future opportunities for us to kind of improve our systems?
I think first we need to account that mental health underpins every aspect of living. And it's not, mental health is not just an aspect of cognition, it's an aspect of just well-being. And I think in the last 2 years, what we need to really look at is the trauma that COVID has brought on. And we need to really account for the intergenerational trauma that, if not addressed now, will be passed on to the young and to our youth, which means that we need to actually account for the trauma. While there's a lot of conversation around immunization, vaccines, recovery, whether it's in the corporate sector, whether it's recovery in terms of recovery to just general to be back on the road. But what we are not accounting for, and in fact discounting, is the impact of these 2 years, which may not even show up now, but it's going to show up in the next 5-6 years. So for me, I see the importance of data and the importance of technology, but I think I see something which is what we call the softer aspects of humans, which need to be really intensified and brought to light. And I call it the 3 C's. That's connection, which is connecting to each other, compassion, to be able to understand, because mental health has always been looked as very individualistic, and India is a collective. So we need to look at collective trauma, collective depression, collective anxiety, and we need to work collaboratively. That's the only way forward. If the 3 C's are brought together and we account that mental health underpins just life and living, I think it's very, very essential for us. And I see a future only when we account for mental health.
Thank you. Thank you so much, Anna. Vibhav, if I come to you, and then, you have been at a forefront during the COVID-19 with the home care. And there were very few takers of home care in India, maybe a 5-year, 10-year back, and they were seeing mostly the people can be treated only in hospitals. But at Portia, you have been leading this initiative of actually changing a lot of things, actually, and attitudes about the delivery of healthcare. Why do you see India's position in terms of home care and the future of it, actually? How big you think the industry can grow in India, given the kind of massive population we have?
So I would just look at, say, what Dr. Kishore was saying or what Suresh was saying, actually. If you look at what has happened in the last couple of years, of course, it has not been a great situation to be in, but in many ways, we could see ourselves in mirror. I mean, before that, we always had this data saying that how many beds we have per 1,000 people and so on and so forth. But the starkness of that came out so badly in last 2 years, and probably much lesser in wave 1. And after wave 1, we thought, okay, we are back to normal and life will get back to normal. I think wave 2 really shook us as a country. And if you are in North India at that time, Delhi, Lucknow, those kind of places, it has been like really horrible. So I would say, of course, a tough situation, but it has also forced us as a country to look at innovation, also forced us to look at new ways on how healthcare can be managed or delivered. And I always look at this from India's perspective. In my first company 20 years back, we used to do this call centers from India. And that time, India had only copper wires as last mile connectivity, and US had gone to 2-3 rounds of last mile connectivity. And India moved from copper to fiber when US was moving to fiber. So we have this shortening of learning curve. I think COVID is that moment where healthcare will probably shorten a lot of learning curves in how do you support healthcare outside the hospital. So as Dr. Kishore was saying, doing tertiary care, of course, you need good hospitals, high quality healthcare delivery in the premises. But everything which comes as outside the hospital healthcare, I think is set for a big change. So whether it's digital healthcare, what Anna was saying, I mean, if you have to do counseling, today you can do counseling anywhere and everywhere with using technology, right? So I would say things like digital healthcare, things like home care will basically take healthcare to the doorstep of the patient. So this also tilts a lot of balance in favor of patients, right? So I think the balance is moving from being fully hospital-centric or clinic-centric to being patient-centric. And everybody has to work on that. So the whole patient engagement, working with patients using home care, using outside the hospital, other methods, I think are here to stay and grow. So you are right. I think home care became a lot more central in last 2 years. I mean, for the first time, insurance in India covered COVID home care as part of their policies, which was earlier it was only domiciliary care as part of other policies was covered. COVID home care got covered in insurance. So that's one big change you see. So the way I look at it, tertiary care, of course, will happen the way it's happening today and will only grow. And we need to have that presence everywhere. Whether it's primary care, preventive care, chronic disease management, elder care, those kind of things India really needs to focus on will all happen outside the hospital more and more, and ideally at the patient premises, right, in their homes. And that's where home care has a big role to play. We saw massive changes from our ecosystem healthcare. Look at pharma companies. I mean, a lot of pharma companies, oncology patients, they are not looking at coming to hospitals because of COVID situation, because they are most vulnerable. So what can you do to support them, at least for their daycare kind of thing at home? Those kind of requirements we saw actually, right? Similarly with companies, we did so much of what we call oxygen management for companies, right? So there's so many new innovative solutions which came in last couple of years, including home isolation. We started that with government of Delhi and is scaled across the country. So those kind of things have come into play. So just to summarize, I would say that apart from tertiary care, everything else has to be patient-centric, a lot more. And home care has a big role to play in that, along with, of course, digital healthcare.
Thank you so much. I think we are seeing fundamental changes, actually, the way, and that's a global scene as well, and technology certainly plays a critical role, and it will change a lot of things in healthcare, maybe perhaps the way we cannot even imagine today, how things will change in the next 5-10 years. Like, there was no concept of ordering medicine online. Like, you need to go find medicine. Today, you can just book or order, and then the medicine will be there. So that takes me also to the second round of our, we will go a little bit deeper into your areas of expertise and try to summarize, a couple of things which are still, like, we're looking at a future and we don't know the answer. Like, for example, one of the major killers in India has been a cancer. And the burden of this disease has been really devastating. I think we have more than 1 million cases in a year. More than 9 lakh people die in a year because of this disease, and we don't see much, to be honest, like solutions in terms of visible to the families. Maybe they're diagnosed late, they come to hospitals late when there's little hope. And I will come to you, Suresh, with that. You recently set up the Neuroscience Center, and one of the key initiatives is essentially it's about dealing with the cases where people really are, sick with these deadly diseases. How do you see the burden of disease when it comes to cancer or neurological disorders in India? And what are you thinking are the major challenges in terms of providing treatment to the patients who come to you with these particular, elements?
I think, Syed, you're right. The burden is enormous and it's growing. And it's growing because of, I think, two broad reasons. One is that the burden was unknown, it was always there, and better diagnostics and better access is actually discovering it. And the second is, of course, lifestyle changes are also accelerating some of these diseases, particularly cancer. I think, there are some cancers which are more endemic to India, like head and neck cancer. India is a head and neck cancer of the world. In terms of primarily due to chewing of tobacco. But we need to look at the 2 million cases approximately that are getting detected every year now of cancer. We're still getting 75 to 80% in the later stages of detection. So our biggest problem is not only access to healthcare and tertiary healthcare, which is obviously concentrated in the tier ones and increasingly tier twos, but we also have a significant problem because it is detected late. And obviously outcomes are significantly worse, more expensive if it's detected late. So I think our primary focus has been in terms of going out there and creating awareness and figuring out how do you catch it early? How do you screen early at a lower cost? How do you catch it early at a lower cost? And I indicated in my earlier point that COVID in many ways is an opportunity because people are thinking about health, number one, in every single household. There is no household that does not talk about screening, which was not the case just 18 months ago. And so we can use this as an opportunity to truly get in and say, how do I screen early for oral cancer? When there is no cancer, can we figure this out through just an oral examination, which doesn't cost anything except somebody literally looking at a picture or an image and mapping it into the potential causes of cancer. So using AI, using technology, using the network that we have with ASHA workers or the equivalents across the states into plugging into the households, into early detection will actually make the change in terms of how we look at cancer. Of course, you need the tertiary care centers, you need standardized protocols, you need guidelines for treatment, which is another issue because we don't have integrated healthcare. So people take treatment.
If I take one more, is there any particular reason we are having the burden is raising really at a very high speed in the last 5-6 years? Is there any particular reason for us we need to be careful of? Maybe like you see it?
Well, I definitely think lifestyle and food are significant causes. I think that is definitely stress induced that is inducing some of the cancers. The ability to figure this out is obviously is difficult. But if you look at just simply the comparisons with the advanced countries and what we had seen, for example, breast cancer is an urban disease more than a rural disease, right? Whereas hygiene-related cancers like cervical cancer are a lot more rural than urban. So we know some of these causes. Head and neck cancer is clearly linked. 40% of all cancers in India are related to tobacco. So we definitely know the causes. And the fact that this is now accessible at a younger age is impacting the increase in incidence. Right. But I also think that it's better diagnostics. We know it now. People are going and getting themselves checked. Unfortunately, late.
Right.
So,
right.
Yeah.
No.
Syed, can I just...
yes, please, Dr. Kishore, yes.
2 points. I think Suresh made a very valid point. Some cancers are rural, some cancers are urban. That takes me to the concept of research. See, India has got so much of clinical data. For example, if you look at COVID in the last 1 year, the health education was so important in raising awareness. Similarly, health education and research go hand in hand in raising awareness for cancer prevention. There is absolutely no research at all in India. The research has to be given preference. In Cloud9, every time we want to do a research, it takes almost 3 to 4 years to get various permissions from various organizations involved. So the research has to be given priority, especially in the healthcare sector, for the problems what we have. The second issue is vaccinations. Vaccinations has taken a backseat. We have had hepatitis B vaccine for 30 years. which can prevent hepatocellular carcinoma or cancer. Similarly, we have a cervical cancer vaccine. There is absolutely no health education whatsoever, whereas we are losing one lady for cervical cancer every 9 minutes in India. And why are we not using the health education and vaccination and preventive measures to prevent these cancers? So India has got a long way to go with the health education and clinical research. Over to you.
Right. That takes me to Sabahat again. We talk about too much about data-driven, medicine, information, and it's about how do you see the role of data actually, because there's little awareness actually about a lot of things actually. And we see data can make a lot of mapping trends and can help to provide better solutions in the long term. How do you see data-driven technologies helping us dealing with diseases like cancer or like a home care for that matter?
Yeah, so as I mentioned earlier, in fact, the origin of data science itself comes from medicine. So medicine has been using it for a long time. But what has changed is, I think, the availability of data. The mass of data that we have available in various systems is huge. That's the reason why it's called big data, for example. But there are challenges. For example, there are a lot of handwritten prescriptions or reports, I may say, readable only by a super trained pharmacist, to medical records which are stored in siloed, a variety of systems across hospitals, clinics, labs. I think all this needs to be brought together.
Are there about the case studies, for example, you have been working in the industry, leading a kind of a tech support to very critical interventions. Are there case studies or success stories? Maybe you want to share one where really the technology made the difference in the last couple of years here.
Absolutely. In fact, from an advanced analytics perspective, from a machine learning perspective, using that mass of data, if you're able to segment the types of patients, you are able to segment or categorize or classify based on the symptoms. Maybe new syndromes can be identified. So a lot of work has gone around that using these advanced tools.
Right. Let me go back to actually, Vibhav, on a home care. Like India is a massive country, and home care, as you mentioned in earlier remarks, has a huge role to play. What are the critical challenges if you identify one or two things actually which could help? Like you said, it was covered under the insurance, that really covered a lot of population. Are there a couple of hurdles still which you think could be removed and that will help the scale, help to take this at a major scale?
I think insurance, of course, is one important one, because if India's everything is self-paid right now from a home care perspective, so I think that's one thing which has to be supported with. I think that's one thing, and I think now there's a lot more awareness and openness to do that. Second, of course, is that we have to look at how government can support more in terms of making it more mainstream. So, I mean, if there are other initiatives which can be taken up from a government perspective, from a policy perspective to drive that, take it as an industry in itself. Of course, we are part of healthcare and have been there for a few years now. But can this be an industry in itself with support on probably look at things like having more nursing colleges? Fact is, if you're looking at home care, you can have courses around which are relevant for home care, right? So, of course, as I was mentioning, you do care in the hospital and everything else beyond that. If you do a level 4, level 3 kind of care at home, or even level 1, level 2, that kind of thing can be supported at home. Just from a Cloud9's perspective, and we have been working with Cloud9 for last many years, supporting them with all their home care needs for the new mothers. The courses which can be created for handling new mothers, handling new babies, right? Those kind of things, because they're very specialized courses which can create that cadre. So the fact is that from an employment generation and home care go hand in hand in a big way. So if government takes policies which creates courses, creates specialized programs around those things in creating workforce. That's again something which can really help us to scale this very, very fast. I think now where you stand, I think using technology, using the current capabilities, I think it can scale quite rapidly, and we are seeing that because consumer demand has changed. I think consumers are a lot more open to consuming healthcare digitally as well as at home. So that's, I think, one.
If I ask you a quick question on a supplementary, are you seeing different patterns in terms of geographies in India, that people are more open to home care in particular area and still there's not too much awareness, and there's not infrastructure available in other states. Like, which states are leading in home care in India today?
So I would say Karnataka, of course, Karnataka, Delhi, of course. Delhi is probably the largest home care market right now from an awareness perspective. So it's today's world, it's probably led lot by corporate hospitals. So wherever we have large number of corporate hospitals and organized healthcare in that sense, so all the metros, mini metros, those kind of cities are leading it quite a lot. So Bangalore, Delhi, Bombay, even Pune, Hyderabad, those kind of cities have been fairly large. But we are seeing lot more demand for it coming. In fact, we are as an organization, we are present around 25 cities right now, and our plan is to get to 100 cities in next 18 months. But the fact is, because this is basis the change in consumer behavior. Right. During COVID time, we got demand from like every small location. All saying, can you do this? Can you do this for us? Can you set up an ICU at home? Because I got like in live that saying, can you set up an ICU at home for COVID? And from all locations, demand is there, and we can build it.
Wonderful. And let me come to you. We have been going through a really unprecedented situation in the last 2 years, and every individual is exhausted. What are the long-term implications of COVID when it comes to mental health? How do you see what will be our challenge when we come back kind of to a normal life, maybe in the next some months or a year? How do you see the situation? We don't know about still the data about the self-harm. We don't know a lot of things still, actually, what's happening. How do you see, as a career professionalist in this area, what are the implications for us recovering from COVID?
I think the first thing is the definition of normal itself is going to change, because the entire globe has gone through a traumatic experience. Those who've been patients of COVID, those families who've been impacted, I think that's one. So the sense of normal is a new normal. And when I say that, I'm saying that unless we account and address that there has been trauma, we are going to have a whole generation of trauma impacted youth, just like we had post World War II. And that is long term, which is why I'm saying that we need to address the impact of COVID, which will be transmitted for whatever reason to the next generation. And having said that, I also see this as a time where we can actually use technology in the area of mental health, technology to educate and sensitize people with regard to mental health issues, and also use technology to actively use the lay counseling model, which is actually to provide psychological aid, say in tier 2 and tier 3 cities, not in the metros. In the metros, it's much more seasoned. You can use that because Africa has started using this lay counseling model to actually provide psychological first aid. I think we need to redesign even mental health interventions. It cannot be especially for India, which I've been actually continuously saying, we cannot use Western therapeutic interventions because culturally, we are a collective society. We are a group. We don't work with individuals. We function as a group. So our whole approach itself, even in technology, has to be group-based. And I see that as really something for the future. Having said that, I feel if the time is now, if all of us don't come together and address that there has been trauma in different ways, it's going to not just play out next year or year after next, it's going to play out in the coming generations. And I think that is really my concern. Are we accounting for the impact on our mental health?
Right. Thank you so much. Let me go back to Dr. Kishore. The child health is really it's a huge neglected area in India. We are looking at data, and how many thousands and thousands of kids are dying even before their first and fifth birthday, because we are not able to prevent, not do the minor vaccine. But we're still in the COVID, we're expecting a third wave. We don't know when are kids going back to school actually, how long it will take us, and what are the things we need to do in order to bring them back somewhere, into the school, so that they feel part of society. The impact on kids because of COVID-19 has been unprecedented, actually. So as a doctor who is at the forefront of, helping families and patients and kids, trying to understand actually how they can protect themselves, leading the initiatives on vaccination as well as part of awareness. How do you see the situation for us in the immediate future? What are the steps we need to do to bring back kids to school? And do you think it is the right time to do? Because some states have already decided that they want to go ahead and try whether this is the right time.
Yeah, that's a very good question, Syed. So I think there is no good time in pandemic. Pandemic is, it's a, nobody can predict the pandemic. That's why the pandemics happen. As Anna Chandi was saying, that mental health is important, and kids' mental health is extremely important. And the good thing about the children is the children have a higher ACE2 receptors. We call it as a angiotensin converting enzyme receptor. So the chances of kids getting seriously sick is much less likely compared to adults, because the comorbidities in children is much, much lesser. They don't have diabetes, hypertension. I mean, there are exceptions they can have, but generally they don't have that much of hypertension, diabetes. So kids get COVID only if the adults get COVID. So we have to make sure that all adults in charge of the children are vaccinated. So when we open the schools, it's not just the teachers, the janitors, housekeeping, bus drivers, conductors, whichever the children come across in contact with, should all be immunized. Preventive measures should be followed. Social distancing should be followed. And school should be opened in a phase-wise manner. Again, that's where the research comes into picture, because you don't open the whole country in one go. Open phase-wise, see the impact, how it is affecting. If there is a cluster of infections, close that, identify why the cluster happened, act on it, and then that's how you deal with it. The problem with us in India is there is absolutely no research. Somebody else does that, we look at that. Otherwise, we have social media full of, oh, we use turmeric, that's why it didn't have. We use BCG, we have MMR. I'm sure the first wave was delayed by 2 months. We heard so much of explanations why India is not going to be affected. When the wave came, all predictions went out of the window. So we need proper clinical, scientific data and research to back our actions and implement children going back to school phase-wise to protect the children both from the disease and from the mental health, because a child living in the house for 2 years is not a good thing.
Thank you so much. No, these are very, very important points, to be honest. Like, as we look at the whole, the situation, we are still in a very difficult situation, and some states are going out. And as you rightly said, we have little evidence actually. What is it a right thing to do right now, or should we wait for some more time? So I think these are important thoughts. I also, go back to now the third round of the questions, and I will start with Mr. Suresh again, looking at a role of technology in cancer. And we have seen in the last 4 or 5 years, different hospitals have adopted different, technologies, particularly in diagnostics. If you look at next 5 years, what do you think are the areas of cancer which will be most benefited by technology, which you see coming in the next 5-6 years?
So it is impacting all the verticals. If you just to look at it, screening, diagnostics, treatment, and continued post-treatment follow-up. The various phases of any lifestyle disease, but particularly for cancer, I think technology is impacting all of these verticals. As I mentioned earlier, I think our biggest problem is, apart from the access to tertiary healthcare for a large population, it is about early detection and even awareness. I mean, the fact that there is a lesion that is growing on your body, visible, very often visible, very largely visible, and yet people are not taking action. We've seen people with very large tumors coming to the hospital, even in private healthcare. I mean, we know in government healthcare, maybe we see that very often, but even in private healthcare, when you see that, it is not just awareness, there is fear, there is ignorance, there is a lack of trust, there's a trust deficit in healthcare that impacts all of these decisions that patients and families are making. So I think the application of technology that addresses many of these elements will become extraordinarily important. And I think Vaibhav made the great point that in 2 years, what we have seen in home healthcare was probably, 20 years ago, I started a telemedicine company, but it was obviously the wrong time, in the wrong place in India. But it was as important at that point of time. But now you have technology, you have access, people's awareness has increased, and there is openness to say, it's okay, let me do a video consultation, or let me access, share my healthcare data with somebody sitting outside. And I think this is not urban or rural, it is across the board. And the openness, in fact, for rural is even greater, maybe, to access technology when it is directly beneficial. We know that, for example, Amazon's largest sales comes from tier 3 towns and not from tier 1 towns in the country today. So the access to technology and the availability, primarily in awareness and early detection, will have the greatest impact. There are a lot of tools out there, a lot of innovations out there. I would only say that it is important to focus using the data, using evidence, Indian data, rather than just copy pasting what we know from the world, and learning from it and be true to it in terms of research, I think is extraordinarily important. There is a lot of advancements in diagnostics and treatment, and I can go on and on. But I would say the biggest impact.
If I ask you in a layman's way, like, for COVID, we figured out vaccine within 1 year, and it was a deadly virus. Why are not we able to find medicine to so many diseases which are related to cancer?
I think we have come a long way in terms of improved patient outcomes and survival. If you compare survival outcomes for patients in advanced countries, you can see a decline in terms of the death rates in a large number of cancers. In India, it is not visible, primarily because, as I mentioned earlier, the rate of growth is kind of surpassing the rate of better access and treatment. But we definitely are seeing a reduction in death rates in the world. It is much more complex. And number one, it is not one disease. We must realize that cancer is many, many different diseases, over 150, maybe 200 broad categories of diseases. And therefore a specific focus. So if you look at head and neck cancers, there are many different sites for head and neck cancer. Breast cancer, there are over 150 protocols that are published worldwide for just what I call a category for breast cancer. So the complexity of the disease, the changing nature of the disease, and I think it's a fundamental nature's way of dealing with the human body. You're only trying to prolong life, right, and you're trying to figure out how to improve quality of life.
Right.
So I think the biggest part that we need to look at is not to only try and change the very basics of nature, but at least address the large proportion which are lifestyle related, which are related to early awareness and where it is preventable, and where we already know there are solutions available. Right. Those, if we address, we probably are hitting 50% of the cancers, which is not trivial when we are losing, as you said, 8 lakh lives a year.
Right.
Syed, to answer your question in a short way, COVID is an infectious disease. So we know how and why it happens, and we call it as a pathogenesis in medical words. So when you know pathogenesis, it's easy to find a vaccine. In cancer, we don't know what causes it. We have theories that this may cause, that may cause. We don't know what causes the specific cancers. So until we understand the cancer etiology, or what we call as a fully understand the pathogenesis, vaccine may be difficult.
Right. Let me go to Sabahat on technology again. What are the, we talk about too much tech-driven, data-driven solutions, and there is a change happening. But what are the couple of obstacles you're seeing, which could actually, if we remove those obstacles, that can help us, use technology better? Like, for example, you can't use drones in India for a lot of things, like for surveillances of diseases. You need permissions for a lot of things, a lot of technology. So do you see identify a couple of obstacles which, if the government removes or market removes, that will help us to have a better healthcare?
Syed, I'm seeing a change in the mindset. I think that was the biggest obstacle. For example, people were very averse to adopting cloud technologies, and cloud can help you in a lot of ways. there were a lot of issues in terms of data privacy. It is still there, that needs to be addressed, but people, institutions are not willing to share their data. I think these are two primary things which are coming in the way. As far as reach is concerned, even in rural areas now we are seeing internet being used. In fact, if you look at the data plans being sold, I think rural areas are the ones who are actually using it the maximum. So I think that obstacle is going away. Data privacy also, I think over a period of time will go away. But if the government also comes in, addresses this, even from a COVID platform perspective, I think a lot of people were wary in terms of downloading the app and using it. So if government comes and says, this is how this will be handled, data is safe, for example, encourage telecom companies to invest in the rural areas, encourage an ecosystem around the COVID platform, for example, to develop innovative solutions, which will help in terms of patient care. I think that will help. Even wearables, I think this is the next frontier for medicine. We are still talking about patient care. What about the wellness side? What about the preventive side? And wearables can go a long way. So making it easier, make in India for wearables. I think these are some of the things which, if government is able to tackle using the private partnership as well, it'll go a long way in improving healthcare in India.
Thank you. Vibhav, if I come to you on telemedicine, you mentioned it earlier. What are the couple of things which you see as a trend now for like next 5 years?
So one thing which we are seeing clearly is that basically telemedicine we are seeing not only from, of course, doctor consult, which is the big thing. So telemedicine is a lot about primary care consult earlier, but I think a lot of specialist consults are happening now, also leveraging technology. I think that's one big trend which we are seeing and which will only grow. Second thing, all the other we look at, say, what we call like a other support is not necessarily doctor talking, could be a paramedics talking, like a nurse talking to the patient, or a counselor talking to the patient, or a diet consulting, those kind of things. Also online physiotherapy. I mean, some of those things haven't happened earlier, but video physiotherapy, if you can do yoga and gym training online and using video consults, you can surely do physio and other things also. So I would also say there's so many other streams which will open up from a teleconsultation, telemedicine perspective, which were traditionally being done either in the hospital, clinic, or at home. So I would say that both of these will grow quite well in next 4 to 5 years. So we see whatever people can move to leveraging technology. I think that trend we are seeing already happening.
Right. Dr. Kishore, how do you see the future hospitals in terms of technology?
So I think
if I ask you this way, are you going to hire more technologists in the future than doctors? So how do you see the role?
Yeah, no, definitely. I think the answer to that question is, see, if a few decades ago, what happened is ambulation, ambulatory care became quite popular. Before that, if somebody gets a pneumonia, they're admitted for 14 days. Then the concept of ambulatory care where patients are admitted less than 48 hours and then sent home with the home treatment, laparoscopic surgeon came. I mean, the hospital stay became less and less. So similarly, the outpatient treatment is going to be revolutionized with the telehealth medicine. I mean, in the last 1 year, we have had parents who have delivered in Cloud9 years ago, but living in countries like Fiji, Cayman Islands, Europe, are all calling us. And when they go on holiday, a lot of parents who are in Bangalore go to their hometown in Orissa, Bihar, West Bengal. They want a continuity of the care. They call us in telehealth and the teleconsultations. So definitely the digital transformation of health is here. And especially the rural areas where the health penetration specialists, super specialists are not available, are going to be better served by the urban areas. So the equality of the healthcare has to be technology dependent.
If I ask you a quick question again from a hospital perspective, like future-proofing technology, like if you keep changing technology all the time, it's quite expensive. So how do you take care of that? How do you make it a future-proof? If you make it, if you're buying a machine, how do you make sure that this machine will at least stay for 1 or 2 years? Is that a concern for you as a hospital administrator as well?
Yes and no. I think the return on investment is one of the things which definitely every MBA and healthcare administrators will start looking at the Excel and say, is this better or is it good? But at the end of the day, just because the technology has advanced, you still have analog telephones. You will not be serving the right population and you're out of the stream. So it definitely goes hand in hand. If you keep thinking only a ROI, you're not going to improve. So it needs to be up to date and needs to cater for the Generation X,
Right.
Generation Y, Generation Z. Otherwise, you're out of the competition.
Right. We're also opening up, question answer sessions in between. If the participants have any question, you can put your questions in a chat box or on YouTube. Some people are joining on YouTube. My colleague Surbi will, collect those questions. I will come to Anna with you with this. On a mental health, we have seen a lot of celebrity talk, a lot of shows about it. And there's a lot of, like this thing, but on a ground level, we still see huge stigma attached to mental health. And people are reluctant to seek help in our own families. They know I'm absolutely fine. I'm just like a little bit stressed. And how do you see, how should we address this challenge? We are a massive country. If I look at the data, if I'm correct, more than 2 lakh people commit suicide every year. And we're looking at data and we're looking at how actually students immediately after exams are most vulnerable to suicide. But neither parents nor the schools, there's no system of awareness out there. So how do you see that challenge and what are the solutions you think to remove the stigma from mental health?
So I think one is that public stigma, there is public stigma. Having said that, I think it is slowly coming down, say, even in the last 5 years. I think COVID actually brought about a big change, not in public stigma, which impacted organizations. For the first time last year, I've had very, very large corporates reaching out and asking for mental health education and sensitization to all their employees. This has been a huge shift. They reach out on their own, saying we need to address that. So I see that change. I think, again, we need to address mental health as part of our education curriculum, because very often it's negated, and our educators, when it happens to children or youth, our educators don't understand it as a mental health issue and therefore are not sensitive. So I think we have to do education in large numbers. And I think for that we need government, because they are the only ones who would actually be able to do that. So I think the whole educational curriculum has to include an aspect of mental health, and it's important in not just because when it's a pathology, but I think more from the preventive side, that mental health needs to be accounted for. So I think these are ways that we can use it. And I think that's where I think technology can do it. I also want to say that in our practice, just during COVID, because of technology and because of tele-counseling services, we've had the Indian diaspora from about 32 countries reaching out. Because in the end, they do want to speak to therapists and counselors who understand their cultural frame of reference. They may be living in a different country. But as I said, we are a collective. Our whole Asian approach to thinking is so different. So that has happened. So I think to me, it's about bringing together the collaboration between technology and the human aspect. And as Dr. Kishore said, not only focusing on ROI. We need to bring in that element of compassion. Everything cannot be a return on investment.
Right.
It has to be human investment.
Thank you so much. And so if you want to have quick questions from audience.
Thank you so much, everyone. What a wonderful session and what a wonderful discussion that we had. We've gone live actually on YouTube, also and other platforms. So we're gathering questions. They're like, we're bombarded with questions, which is so good. So I'm just going to put a few ones here because we're a little tight-strapped in terms of time. So my first question today is to Dr. Kishore. Our participant asks, we have been hearing about the third wave targeting children. Is there any truth in it? Is it a study-based theory or not?
No, it's definitely not study-based. The hypothesis behind that was the first wave affected the elderly people, second wave affected the middle age group, So they thought the third wave will affect the children. As I explained earlier, the third wave is not going to selectively affect children without affecting the adults. And definitely children are less likely to suffer hypoxia and comorbidities and deaths like adults. Definitely the reason that has come is India was criticized that second wave was not predicted. So they thought they'll predict the third wave. If prediction works, then the pandemic wouldn't have happened. And children will not get infected unless adults get infected. So it is important that we immunize the adults, follow the preventive measures, masking, social distancing, hand washing, then children will not get infected.
Thank you so much, Dr. Kishore. I think that was wonderful because I'm sure people are so scared. The school's not reopening because people are fearing that the third wave might infect children. So thanks, I'm sure our participants would get some insights. The next question is, while people are aware about COVID symptoms and hence getting tested, this does not happen for cancer because of lack of awareness. And about symptoms, how can this be addressed if...
Dr. Suresh.
Oh, I think increased focus on primary health and early detection and screening is the only way. I think the public-private collaborations for this has to be enhanced. We need to incentivize this. Technology can help a lot. There is a lot that you can do with digital education now, multilingual education that you can do. If you can make it easy for people to take a photograph of of a lump or of something that is suspicious and send it out and get a quick opinion, or using a bot or an AI tool to respond back, I think people will do it. There is a tremendous opportunity because of COVID, as we discussed earlier, to get the screening into the homes of people at a very low cost. And I think these are the ways in which we can actually prevent the cancer epidemic, because we have seen huge delays in patients coming to.
Thank you so much, Suresh. The next question that our participants have posted is, how does tech help in expanding the boundaries of telemedicine? There are consultations that require some degree of intervention, be it the status quo. So how can we handle that?
I think that was covered during the session, actually. But still, if Sabhat or Vibhav, you want to chip in.
I think some of those, of course, doctors will go more by symptoms and by probably some of the readings, and Dr. Kishore can probably answer that better than I do. But other thing which we are seeing now and probably grow is that also point of care devices. So what we are looking at is that patients or consumers will also probably start using it a lot more than what they are doing today. Your oximeter is a good example of that. So you'll have things which can measure BP, sugar, those kind of other things also, which give indications for vitals. I think are again something which is likely to grow, and we are seeing some more demand for that coming up.
Yeah, I think we saw it happening in COVID. During COVID, I think people were taking an online consultation, and that worked pretty well.
Sabhat, do you want to make a point?
Absolutely, I totally agree with what Vaibhav has said. Earlier, the only thing people used to have is a thermometer. Now you have oximeter, you have blood pressure monitors, and there are connected devices also which are available, which will be very useful in telemedicine, especially in the rural areas.
They've also got oxygen concentrators at home.
Yeah,
so treatment as well, not just diagnosis.
Yeah. It's an OTC product now.
Yeah, I mean, we saw that people importing it from the other countries during the demand time.
So we two more questions, quickly.
Yeah, okay. So the next question is for Anna. For all the celebrity awareness about mental health, we still have a huge stigma attached to it. How do you think we can overcome?
I think that was covered. I think there's also one question about data. How can data help? How data can help the
mental health awareness in India? Yeah.
If you want to take that, yeah.
I think qualitative data helps primarily, and quantitative. Qualitative data, because you have questionnaires showing symptoms and then kind of bucketing them, so that helps. In fact, we do have a research which the foundation did, is how India perceives mental health, and we had data. And one of the things that came out, and which was shocking to somebody like me from Bangalore, is the stigma in Bangalore in mental health is much higher than, say, Kanpur.
Yes.
And I was ashamed because I thought I came from a very progressive city. So I think data does help. and I think it's important to understand about celebrity stalking. It's not about celebrity stalking. The celebrity stalk, there's a certain amount of visibility, but what happens when celebrities stalk is they enable people who aspire to be them or who emulate them to feel that it's normal. If somebody like this who I emulate can have these kind of symptoms, and I also have something similar, the relatedness increase, so it kind of minimizes their shame.
There's also a question, I think, again on a cancer. How does India, expand cancer care, and also how to keep the costs reduced so that people do not really have to pay a lot of money for cancer treatment?
Well, the cost of drugs is sometimes expensive. Cost of resources and specialists is going to be expensive. A lot of the technology and the devices for treatment, like radiation and surgical devices, like lasers now coming in, robotics, etc. There is a reduction in cost overall, but it is still expensive. So we can't address that as much. And I think the big part is to figure out that if you catch it early, you can improve quality of life and you can reduce costs. A lot of the treatment costs are significantly lower if you catch it early.
Right.
So I think our prioritization should be on catching it as early as we can, but through awareness and early detection. And technology can go a long way in that.
Thank you. There's a last question. I think, Dr. Kishore, you're the best. It's a general question: how to raise healthy kids?
How to raise healthy kids? I think you have to remain healthy, and you have to lead a healthy life, and then you need to follow the healthy lifestyle things. Syed, I just jotted down a few points.
Please go ahead.
Yeah. Recommendations which from the health summit.
I will come to that. That's my last question to all of you, actually. Okay, yeah. Let me put it this way. So we have the last round of questions, and this is essentially a one quick recommendation you have to the government dealing in your areas. What are the one key recommendation you want to make to a health minister of India or health minister of Karnataka about improving the healthcare, health delivery, use of technology, use of mental health? I will start with Dr. Kishore with you, but it's just a quick thoughts.
I realized when Dr. Jacob John said we are dominated by S's. So I'm going to use L as the alternative alphabet here. Leave politics out of healthcare delivery. Learn from the experts. Listen to the grievances. Let talent flourish. Lend your hand to the private healthcare. Limit doles and freebies to religious institutions, and instead support the healthcare industry and establish primary, public, and preventive healthcare. Thank you.
Sabhat, quick thoughts from you.
Yeah, sure. In fact, what I would like to cite a study which says that 38 of the Fortune 50 companies are now investing into healthcare. What it shows, and what we have heard from so many people from the medical fraternities, technology has a big role to play. And I think the way government had encouraged green technologies earlier, they should also encourage development of healthcare devices, for example, local manufacturing and so on. I think that's very important.
Wonderful. Anna, you want to?
I think I'd like to start by saying that COVID has exposed our social structure and all the social issues, whether it's any form of violence, sexual violence, domestic violence, migration, unemployment, financial instability, farmer distress, substance abuse, income gap, access to primary health care, all impact mental health. So unless you address mental health, this is going to be like a spidering effect all over. So it is, mental health does underpin life and living.
Suresh, if you have to make one recommendation to the Health Minister of India, what would be that?
I think focus on improving the primary healthcare access for lifestyle diseases like cancer, early detection and awareness, and removing the stigma, and public-private partnerships to utilize the talent and access that is there in India, and providing that for the larger good of the entire nation.
Weber, what will be your recommendation?
I think mine is very clear. We should cover home care under insurance. I think that will be a big game changer for creating.
We should cover. Sorry, we should cover. Sorry, if you come again.
We should cover home care under insurance actually. So
Insurance
should be covering home care. I think that's one big thing which we are looking at.
Wonderful. I think really my pleasure hosting you all. It was really thought-provoking and a lot of things to take back from this session. And we're going to make sure that we make a video. It will be available to a lot of stakeholders, and we're also writing about the sessions. I thank you all for joining. It was really our pleasure to be here with you. And I hand over back to Surbhi for the next session.
Thank you so much, everyone. Such a pleasure to have you all with us.
Thank you.
Thank you so much.
Thank you.
And our participants may still have a lot of questions. I would request them to post it here, and my colleague Shivali's email ID is going to be there. You can still write to us and we will get it addressed. With that, I think we will move on to the next Flash Talk sessions. And I will now invite Jisha Krishnan, who's the editor of First Check, to moderate the next session. Over to you, Jisha, with that.
Thank you, Surbhi. Am I audible?
Yes.
Yes, Jisha.
Okay, thank you. Thank you, Surbhi, and thank you, Syed, and all the panelists for helping us reimagine the future of India. And hello, everyone. I'm Jisha Krishnan, the editor of First Check, Health Analytics Asia's flagship fact-checking initiative. As we come to the end of this third edition of the Health of India e-Summit series in Karnataka, I have the honor and pleasure of introducing 6 innovators, dreamers, futurists as part of this Flash Talk session. I have one question for all of them. That's what they're going to address over the next 5 minutes each. How can India leverage technology to deliver better healthcare solutions? I'll start with Deepak Pillai, who is the co-founder and the COO of EkaCare, a leading Bangalore-based connected healthcare startup that brings doctors, care seekers, and labs on a common digital platform. EkaCare has several firsts to its credit, the latest being that it was the first startup to integrate with the COVID portal to provide easy slot booking for COVID vaccination, pre and post-vaccination teleconsultation, and vaccination certificate downloads, and all this on WhatsApp. So welcome to the Health of India Summit. Deepak, the floor is all yours.
Hey, thank you, Disha. Good morning, everyone. I was attending the last session, and then I also realized that everyone was talking about how the data in the healthcare can be utilized and can add a lot of value, and that's what we are also trying to build. And it'll be helpful for us to, for me to explain our journey, why and what we look at the values and issues in this category, and how do we try to address this whole concern. So if you look at, when we talk about leveraging technology to bring healthcare providers and care seeker onto the same platform, there's a new word I didn't hear when I started doing research. I used to run a company called GoIBibo before this, was a co-founder, and Vikalp and I both moved out about 4 years back. When we were, as a layman, when I was not in healthcare about 8 months back, I never heard a word called care seeker as such. And we were researching, what will you call? I didn't want to call patient, or I didn't want to call, consumer. These are the two very, very different terms that have been used at different levels. And I spoke to multiple healthcare owners. And then I realized, there is one who needs care. And that's what we are all here. It's an industry where we're giving care. And then we started digging a little deep. Who's this care seeker? In today's world, there's this new element in the delivery, which is called care seeker, which is the custodian of healthcare in the family, a person who pays 70% of the time from their own pocket, and then kind of look at delivering healthcare for himself, herself, or the family. And most of the solutions today, they don't talk to this individual. This individual is on WhatsApp. This individual is on Facebook, Instagram. This individual delivers from Swiggy, but we don't really have means as a healthcare provider to talk to this person. There are great tools talking to the patient, but there's hardly anything which is about the care seeker, and that's how we started our journey. And then looking at the healthcare provider, we all understand, as far as we realize after looking at the whole market, is that the whole healthcare provider revolves around the doctors. Whether we can all build nice, invest in hospitals, buildings, we can build machines, we can build AI, we can do whatever. But that one person, which is the most critical piece and needs to be center of every damn thing, is needs to be the doctors, and we need to give that respect, because it is the human being at the end of the day who takes that call, and kind of at the end of the day make everyone healthy and take kind of take those calls. So that when we look at most of the technologies we're looking at, there've been talks about how can a system or an AI generate the prescription, how can a system and AI can take care of everything rather than having the doctors. We believe that's not fundamentally right thing. We need to build tools and technologies to aid, help doctors rather than replacing. That's a fundamental difference between most of the technology companies. And when we started off, that's what we said. The gap today is largely between there are isolated technologies. There are technologies available for doctors. There are technologies available in the hospital. There are technologies with the devices. The consumers have technology. I have a health app. I have devices I'm wearing, but all of them are not connected. There is no platform where today I can see my longitudinal values. I can see, when I go to Medanta Hospital, I'll see some of my data there. I go to Lal Path Lab, I'll see my reports there. They probably lie in my email box somewhere on my WhatsApp, but I don't have a place where I can see longitudinal value of myself, my family members. That's what we started realizing, what is the fundamental problem in this category, and we wanted to solve. And then we started, building some of the solutions which we have today, which, just was mentioned while we have been introduced. We were first company been approved by COVID to do the COVID appointments, vaccination certificates. I think that's a great value which we are bringing in. We are servicing over, we are a 6 months old company servicing over 200,000 customers. We just yesterday we got our 100,000 app installs. So another milestone, and we were cheering last night. But having that said, that's just a beginning for us. We still believe that there's a massive gap. So how do we started solving, and how can somebody look at solving these, through a technology? Yeah, the gap is, how do we bring everyone on the platform? And the challenges in that is, if you look at today, technologies available in the countries are all written. There's no standardization of, key terms so that this data can be merged. That's a big challenge. When you go to a lab today, all the LIMS have their own data sets. We don't have our own Indian standards of defining hemoglobin as a code which can be married and the ranges which can be married. So that's a massive challenge at the back. I mean, even if you go to most of the hospitals, the medicine being prescribed or the prescriptions being written are not digitally coded, which can be merged. So that's a massive challenge which we looked at into this industry, and we wanted to kind of get into solving this problem. So there is, if you look at what happened, why do we need this? Because who suffers out of it and who's paying? So the care seeker who's paying today is literally suffering because of these non-digital data availability. And we started looking at how do we cater. So we started making these apps, which are for doctors, which are for healthcare providers, which are for consumers. And we try and bring everyone on the same platform. Now, as I said, the challenge was how do you now, and we're not the first one trying doing it. There are many in the past have also tried doing it. Then how will we solve this problem? What we started doing is first is collecting data. As a human Indian, I don't have a tendency or a habit of storing this data at all. There would be like 100 people on this call. I've asked this question to many of them. Is there anyone who stores this data digitally or in a Google document or any other storage of their health records and their family health records? I was not the one until 6 months back. I have 2 kids and I don't have even their immunization cards available now. Right? They are 11 and 13. I don't have scans and etc. available. I do my health checkup every 6 months. I don't have my record. And similarly, when I started this question asking with my friends, with a lot of people, there's no one, because we don't really care about that data. We don't really, and no one asks about it. When I go to hospital, they never ask me, do you have your historical data available, by the way? Every time they ask me to go and do a new fresh scan now or fresh lab test now, rather than saying, hey, is there a value available which we can extract out of it? So that is a massive problem. And then how we started looking at is even accessing this data for a lot of consumers is not easy. So we started solving with simple solutions of clicking photograph and forwarding to a WhatsApp number, which is our WhatsApp number, and stores into the profile of that consumer. It's as simple as that. When you go for a scan or a lab test, you give your phone number at @eka.care as your email ID, and it all got deposited into one repository, which is Eka Care repository. And you can access this 24/7 with a consent you can share with healthcare provider as a consumer. This is a massive educational behavioral change on the consumer side and on the doctor side. And these data sets can be available to your healthcare provider. Today, when a patient goes to a hospital, when he becomes a real patient and a chronic patient, the amount of data they carry in their hands via bags and file is unbelievable. Unbelievable. When you go to an oncology department or a cardiologist department of a hospital, the amount of data people carry and the stress on the doctor of sometimes you really feel, how will a doctor be in a half an hour consultation or a 15-minute consultation be able to see all this data and take a meaningful decision out of it? It's just humanly too tiring to look at, just folding the paper and keep reading about it. Just humanly impossible. And hats off to these doctors, they still make meaningful, inferences out of this data. But is that the right way of doing it? Until how long? How do we reduce the stress? Their quality physicians in super specialties are very, very, very limited. So the technology needs to, as I said earlier, needs to help this doctor, giving them longitudinal data in a readable manner. A physician needs to just look at the data and say, hey, whether it's improving or not. So that those kind of journeys are completely broken, and that's what we wanted to started solving. And I'm not here to promote my company, but I wanted to fundamentally push what is the problem statement we realize and how we are looking at solving this problem. So we have as I got the opportunity, I'll just push a little about my company as well. So we built tools for doctors which are solving problem in the clinic, and we realized that the hospitals and nursing homes still have some sort of data which can tomorrow, with the help of government initiatives, should be digitized. But when you go to the clinic level, private clinics, the corner doctor shop, the data availability is just not there. So that's all the starting point. So we started creating tools for doctors, which is solving how can doctors solve the appointment. How can a EMR without...
I'm sorry, I think I will have to cut you in because we are sticking to the 5-minute schedule, but we will all be checking out Eka Care, and all the best. And we are cheering for you, and we hope that you reach greater heights. Thank you so much.
Thank you.
And I'm so sorry for cutting you because I need to go into the next speaker.
No worries. Thank you.
Thank you. Thank you, Deepak. In the interest of time, I'll quickly move on to our second speaker for this session, Dr. Sunita Maheshwari, who calls herself the Chief Dreamer. She's a pediatric cardiologist as well as an entrepreneur who co-founded India's first teleradiology company that's called Teleradiology Solutions. Welcome to the Health of India e-Summit series, Dr. Sunita. We are excited to hear about your journey from being a medical practitioner to a medical entrepreneur. Dr. Sunita.
Thank you very much, Jisha. I think that's going to be tough in 5 minutes. But I think what I'll stick to is you had asked me to speak about teleradiology and how it can impact hospitals and healthcare centers across the country and world. And so fundamentally, when you think of health for a patient and a disease, the fundamental issue is, what is my disease? How do I know what I have? And that's where diagnostics comes into play, CT scans or an X-ray to look for a fracture and so on. And one of the challenges has been that when you do this scan, how do you then get a radiologist who's a specialist doctor who can report it? How do you get his opinion? And in a lot of places, in a lot of parts of India, there are no radiologists. And I think one of the challenges is we have a shortage of them in the country. The last census done, there were 10,000 radiologists for 1.3 billion people. Now even if you say there are about 13 or 14,000 radiologists, that's not enough for the whole country. So that's where teleradiology comes in. So if you take one hospital, they may have, let's say, 10 scans a day. For that, they hire one radiologist. But if you put one doctor in a central location, let's say at his home or in a reading center, and he's connected up to 5 hospitals or 10 hospitals. So he can read 50, 60 scans a day and cover multiple hospitals. So it becomes a very, very efficient model. So essentially, teleradiology is a transmission of images from where the patient is or where the diagnostic center is to where the doctor is. And I think that's something we've been working on in India in the last 15, 18 years. I mean, we're not a startup anymore. Challenges, yes, I think a lot of the challenges have reduced. Teleradiology today in India is legalized, telemedicine is legalized. One challenge is Wi-Fi. Is definitely, I'm sitting today in Gachirauli in Maharashtra, and I was concerned, would I have enough Wi-Fi to be able to do this? But as you can see, I'm able to do it from a small town in Maharashtra. And so that's what has allowed teleradiology in India. In terms of opportunities, I think that there are several. I think at a government level, they have been trying to do, teleradiology for district hospitals and for all the centers that have scans but don't have radiologists. So for instance, we 5 years ago have helped set up teleradiology for the Tripura government. And that project is still continuing and working very well. So I think the opportunities are there. If you look at it today, there are 70,000 hospitals in India, and then another 100,000 diagnostic centers, all requiring, support of doctors. And that's really where technology comes in. I think the biggest, and I don't know if we're going to do Q&A, so I'm just rambling on. But I think the biggest challenge I see really is manpower. Today, we have the technology, we have softwares that are there that enable teleradiology. It's a very well-known branch now, but the manpower, I mean, if you look at training, and I'm a doctor, so if I speak from the medical end, we have, every year we train now, it's gone up. So we have about 84,000 MBBS students. We have about 42,000 postgraduate seats. So every year you have 40,000 MBBS students in this country, in our country, who don't become specialists, who don't have the opportunity to become specialists. And if you look at radiology, guess how many radiologists we train every year in our country? Anyone in the audience want to guess a number? We train 900 radiologists a year. That's it, between MD and DNB. So we've got 40,000 MBBS students who don't get a PG seat, but we're only training 900 radiologists. And we need, so we have 10,000. It's going to take us 10 years to get another 10,000, right? And so the gap is huge. And so if you ask me, one thing that government could do to help this space would be to change the guidelines of training. Currently, the government guidelines are that you have to have 100-bedded hospital to train radiologists, to train DNB or MD. But if you look at tele, our radiologists are sitting at home reporting. During COVID, we were able to run a whole teleradiology service for our hospitals in the US, in Africa, in remote parts of India, in the Maldives, I mean, you name it. We were able to run this service with our radiologists all sitting at home, wherever they were in the world, right? So what does a 100-bedded hospital have to do with training? Tele-world. And I think if I were to say one thing that we should change, it's to change our mindset about training, because we could easily train, tele-train. And obviously they can't do an ultrasound sitting at home, but they can certainly report an X-ray and a CT scan. I mean, I'm a pediatric cardiologist. I ran my whole practice from home during COVID because, it's, if we could change our mindset and say we can train, and hey, how about we get this cadre of, call them what you want, AI-assisted teleradiologists. This could be huge for the country. So if you could get a cadre of AI-assisted teleradiologists who can report, X-rays and CT scans and MRIs, fill the need first for India, and then use that same cadre for Africa. For instance, there are countries in Africa which have no radiologists. So we would then be able to do an import-export and really service patients and hospitals across the world. So I will end with that.
Thank you, Dr. Sunita. Thank you for that very thought-provoking conversation. There's a lot to take home from that. The next speaker for this session is an entrepreneur who has worked closely with various stakeholders in the healthcare ecosystem for more than a decade. He understands the pressing needs of insurance in India, especially in the healthcare system, and is now working in this nascent space with his disruptive startup. So ladies and gentlemen, please join me in welcoming Ravi Chandra, the co-founder and CEO of MedPay.
Thanks, Isha. Hi everyone. My name is Ravi, co-founder and CEO of MedPay. So today, when we look at total healthcare delivery in the country, almost 70% of it comes from primary healthcare, right? Also called as OPD, right? So this primarily includes doctor consultations, medicines, and diagnostics. But the space of OPD is super fragmented. It's highly unorganized. And they don't talk to each other. Forget about talking to insurance companies. So this is the current state of OPD in India. So because of which, standalone OPD centers are never part of cashless insurance networks. So these are not accessible to insurers anymore, right? But these are the centers where OPD spend is happening, right? Because they are not part of any payer networks, as an insured, I have to pay out of my pocket and then claim for reimbursement, which is a time-taking process for both patient as well as a payer. On top of it, it's super expensive to process OPD claims as standalone claims for any insurance company in the country, right? I'll give an example. So last financial year, roughly around 33 million health claims are processed, right? At the cost of $20 to $21 per claim, right? That's the cost to process each claim using existing infrastructure that was fundamentally built to process hospitalization claims, not OPD claims, right? So that's the exactly area where in which MedPay is working towards disrupting the space using technology. We are enabling payers to access large hyperlocal OPD network with capability to process cashless claims in real time. Right? There are no more reimbursements. And it's a win-win for all the parties. Patient is getting a cashless experience, which means no more out-of-pocket expense. Provider is able to be part of insurance networks, accepting insurance payments in real time. And payer, there's no cost involved to process as a reimbursement. So that's the area where we are working today, and we have an API access to more than 50,000 healthcare centers across 500 cities. We cover almost 4,000 pin codes as we are speaking today. And we have already processed $2.3 million of OPD transactions in the last few months alone. And we are now closely working with insurance companies and various other partners, offering our network as a service. So with more technology adoption, payers such as government or even insurance companies will be able to offer more comprehensive OPD coverage, right? So my request to the government is to consider including OPD as a de facto coverage in all health policies. Right? Today, fundamentally, all health coverage is only limited to hospitalization, right? And it's very fundamental and important to cover OPD, right? Only when there is a preventive healthcare in place, as a country will be able to develop a healthy nation, healthy economy, and ultimately we are only saving cost in hospitalization claims. Your payout at the hospitalization is reduced when you are able to catch them early, when you are able to give them preventive healthcare. Thanks, Jisha and everyone for giving me this opportunity.
Thank you, Ravi. Thank you for putting that in the exact amount of time, and also for all these points that you mentioned, because it's indeed amazing how technology can actually be used to easily connect primary healthcare to insurance, and your promise of a cashless claims in real time is something that we would all like to experience when we access healthcare facilities. So thank you, Ravi.
Thanks.
Let's move on to our next speaker for today, Nilesh Maheshwari. He is the head of public health for South Asia with IQVIA, that is the world leader in using data, technology, advanced analytics, and expertise to help companies drive healthcare forward. Nilesh will be shining light on a subject that is very crucial, yet it is not discussed as often as it should be in the public domain. That is building resilient infection control systems in hospitals. Welcome, Nilesh. We are all yours.
Thanks, Shisha, and good morning, everyone. I think you hit the right button when you said that this is a very important topic, specifically in the current pandemic situation. Hospital-acquired infections are the most commonplace complications and adverse events that affect both the patients and the healthcare workers. There have been studies in Indian settings where we have seen considerably higher rates of hospital-acquired infections, reported up to the level of 25 to 40 infections per 1,000 patient days. And with the complicated COVID-19 situation, this will probably rise much more and have much worse outcomes for the patients as well as the healthcare workers. That's a very important topic. Traditionally, infection prevention and control practices and programs have faced multiple challenges in the hospital settings, obviously because of overcrowding, low nurse or a healthcare worker to a patient ratio, as well as from the fact that there has been very low use of technology to drive some of these programs, and the fact that there has been inadequate focus on bringing this upfront to improve the capacity and the advocacy of the healthcare workers, specifically in clinical settings. IQVIA has been working on this with the government and technical institutions to drive some of these areas with the support of the technology. We have partnered with multiple technical institutions and governments to specifically drive based upon behavior monitoring technologies, wherein some of these technologies are very effectively used in clinical settings with healthcare workers, providing real-time monitoring information to the state and the central level stakeholders. Based upon that and a supportive supervision available to the healthcare workers at the ground level can actually increase the adherence levels to something like hand hygiene, which causes about 30 to 40% of the hospital-acquired infections. These can actually, adherence to these practices can increase from 30-35% to 85 to 90%, reducing infections drastically. IQVIA has also been partnering with the Government of India, Ministry of Health and Family Welfare, to develop national clean and green guidelines framework for healthcare facilities, public health facilities specifically. This framework stresses upon the need of having an IT framework for real-time monitoring of the facility with respect to the quality, the processes, and the infrastructure compliance to the IPC and WASH practices in the facility. Moving forward, I think with the advent of the COVID-19, this has to be at the primary focus. And healthcare facilities, government stakeholders, technical institutions, as well as healthcare professionals need to bring it at the focus of everything that is driving from a healthcare delivery perspective. And this has to be brought to the forefront because this affects the overall patient as well as the healthcare workers. What happens is that what is specifically required is for Government of India to bring out standard country-specific guidelines and specifications from an infrastructure perspective, clearly laying out hospital design for different category of facilities. These facilities, these designs should also focus on bringing in aspects related to IPC and WASH, which is the missing factor in many of the government's quality control programs as well. Today, there are many programs which the government is running with respects to increasing the quality of service delivery, quality of processes in the healthcare facilities, right from NABH at the private level, NQAS, as well as Lakshya from our perspective of maternal and child health, as well as Kayakalp. All of these practices needs to be integrated together to build together a larger IT system which can grade the public health facilities and be embedded along with specific IPC and WASH guidelines, which can then give a monitoring mechanism to the stakeholders to see how these facilities are graded and track the performance over time to improve practices related to hand hygiene, related to biomedical waste management, related to infection control practices, which can thus reduce the hospital-acquired infections to a large effect. Second, what technology can bring is in terms of e-learning modules and simulation techniques, which can really provide a lot of emphasis to healthcare workers, specifically in clinical settings, to give those impetus to drive that behavioral change, to be able to get this focus that it is everybody present in the hospital, right from the healthcare workers to the patients, to the attendants, to the administrators, on promoting the practices which can drastically reduce these infections. And this will be very, very important, not just at the larger hospital level, but also at the primary care level, the OPD clinics, the primary care clinics, PHCs, sub-centers in the government, because they will be the first point of contact when it comes to diagnosis, when it comes to prevention with related to COVID-19 moving forward. Because as we have been hearing from the scientific community as well, that this will not go away. It will probably reach an endemic stage and will stay for a longer duration. Thus, this will become even more important. What another recommendation from a perspective of using technology is on the biomedical waste management, because that will become increasingly important when it comes to managing the biomedical waste, which has already been generated and has actually tremendously increased because of managing COVID-19 patients and addressing the concerns related to COVID-19. So a specific portal needs to be maintained to address the biomedical waste management, how that is being addressed at each of the facilities. Capacity needs to be built for the healthcare professionals, as well as healthcare workers in the facilities to be able to manage that, to reduce these infections. I think if we are able to bring the focus back on this topic and have a very high impetus with the government coming up with clear guidelines to address this in the form of IT-enabled system, which looks at both the quality processes which they're currently looking at and the wash practices, it can really give a large impetus to remove and reduce the hospital-acquired infections, which is a key factor today and will remain a key factor moving forward. Thank you.
Completely agree with you, Nilesh. Thank you so much for that very important talk. And now we move on to the next topic, which is perhaps discussed a lot more. It's a conversation that we have more than we perhaps ought to, yet there is very little scientific understanding of how it works. If any of you all have made the right guess, I'm talking about weight loss and diet. How can technology make weight management better? To answer that question, I would like to welcome Puneet Manchanda, who is the CEO of Smart Diet Planner, a startup that does exactly that. Puneet left his high-profile corporate position at IBM to venture into the healthcare startup space with this AI-based diet planner. So welcome to the Health of India eSummit series, Puneet. We can't wait to hear how you're using technology to provide personalized diet plans for weight management.
Thanks, Jisha, for the nice introduction. So I'm Puneet Manchanda, CEO and founder of Smart Diet Planner. I was working in IBM for almost 16 years and was mainly doing the transformation digital projects. When this COVID period started, I thought to transform myself also now. And I started working on that thing. And I decided to focus only on the nutrition in a right way. And I studied about that thing. And then I took a help of dietitians also in my journey. And within 6 months, I was able to reduce from 88 kgs to 72 kgs. But again, the main thing was not just the weight loss. The other aspects also improved. I was having hypertension. I stopped eating hypertension medicines since last 1 year now. My cholesterol levels improved. I was amazed that nutrition really works. I heard about that thing in the past, but when I felt that thing, I really could feel the power of that thing. And not me, just my mother is a dementia patient. And there was a time she was not able to even get up from the bed. She was getting so confused and her dementia was progressing and doctors were saying that nothing much can happen. But one of the doctors then told me her lifestyle changes can help her a lot. Then we started focusing on her lifestyle changes and we changed her diet. We started moving her. Now, you won't believe it. She goes with me for a walk for 1.5 kilometers each day. So I was really impressed that this is something really great. This is really a powerful thing which is not being totally utilized by the people. Everybody understands the power of nutrition, but if you see all kind of technology apps which are there, they are giving just the calories counting, and they are not giving beyond that thing. Or they have fitness applications are there. They'll tell you what kind of exercises to follow, but no one is giving personalized diet recommendations. I thought then why not to create that kind of stuff where whatever dietitians are doing, let us try to replicate that thing. The kind of inputs they are taking, they do certain computations, we'll do the same kind of thing. And Manjari Chandra was my dietitian at that time. She's a senior dietitian in the Max Hospital. So we thought to work together on this thing, and then whatever they do, convert that thing into AI-based approach. So ultimate diet plan is composed of 3 aspects. One is what to eat, second is how much to eat, and third is when to eat. Calories counter, they cover up only one aspect, that is how much to eat. So our idea was that we'll take up the inputs and then we'll compute ultimately how much calories, of course, which is an easy thing to compute. Then we'll create a diet plan which will take care of all the 3 aspects. So how much calories, this is put into the calories need. Then what means the nutritional requirement of the person, such as how much protein, how much fat, and how much carbs. And what is very much aligned to the disorder the person is having, because most of the people who are obese, they have other kind of lifestyle disorders also. Somebody will have PCOS, somebody will have diabetes, somebody will have hypertension. And the recommendation that changes from because of this aspect also. A certain food element might be good for one person for weight loss, but may not be good for the other person because of the other condition that person is having. So we created a database of starting with just 1,000 food items, but that covers up most of the food items which we eat on the daily basis. And based on that thing, then we create a diet plan, a personalized diet plan, which take care of all the 3 aspects. So this fits into the calories requirement, this fits into the nutrition requirement, and then based on the timing principles of the nutrition also, such as orange may not be the best thing to eat to start the day, but the rest of the day, this is a really good thing to eat. So we take all these kind of small things into consideration, and then we create a diet plan for the person. And this is not a static diet plan, it's a planner. Because we ultimately, a person, we cannot be so much prescriptive to a person, this is what you're supposed to eat throughout the day. People have the preferences. So we give a good amount of choices also. And all those choices are color coded, such as from starting with dark green till the red. So person can then take a judicious call. Okay, if he can choose the green items, understanding that thing, if you're adding that thing, it's going to benefit him a lot. If adding a red item, it will not ultimately benefit him, but if you want to eat, then he can always eat ultimately. We can stop the person from eating. So this is how our diet plan works. And we are getting really good response from the market. We launched it just 5 months back. We have around 200K downloads. We have 150K registered users, 1K paid users. We have a good amount of high rating search for diet plan on the Play Store. It is coming under top 10 only. We are ranking almost among the top applications which are there in this thing within just 4 months. And we created the application in such a way that this is not just for India, this is for USA. We launched it for USA, Canada, and Australia also to test the market there. Because we involved even dietitians from those part of geographies also want to make a global application, not just a India specific application actually. Even the insurance companies, they are showing interest because they also want their people to be, whoever customers are there to be healthy so that less insurance claims are there. 2 or 3 big insurance companies have approached us. They have their wellness platform in their application. They want us to expose our APIs to them so that they can also start sharing this information. So I think this is also going to be a next good thing for us. And very soon we are going to launch the corporate plans also. Just few days back, one lady called us from Jaipur and she was very much impressed with the application. She was having diabetics background and she was not able to do the weight loss. She followed our app just for 2 months and she was able to lose the weight and her sugar levels were also down. She was really amazed that using this kind of application, I've been able to improve myself. I've been struggling with the medicines only so far. She really thanked us that we have created this kind of application which is helping her. We really feel good that whatever sacrifices we have done to jump out of our jobs. Even my son has also jumped out of my job. He was in Dublin in Ireland and he was doing a very good job. But he was also excited with my journey and he also jumped out of his job and he's working with me in this thing. He has a data science background. We both are working together on this venture now. Yeah, that's all from my end. Thank you.
That's such an exciting journey, Puneet. We are so happy for you, and I'm sure many of us would like to try and see how your customized nutrition plan works for us. Thank you, Puneet.
Thank you.
And now we have the last speaker for this session. I personally think we have saved the most fascinating topics for the end. So what can the Indian Space Research Organization, that is ISRO, teach us about telemedicine? We have a senior ISRO scientist and head of project management with Human Spaceflight Group for India's Human Space Program, Gaganyaan, who is also the National Honorary Secretary of the Telemedicine Society of India, to tell us more about this fascinating endeavor. Welcome to the Health of India e-Summit series, Dr. Murthy Remella.
Good morning, Jisha, and good morning to all the participants. At the outset, thanks to the organizers for conducting this session and inviting me. But more than that, big thanks to COVID, which has brought the health to the center stage. The wealth orientation has become now a health orientation. And we all now remember the old Indian saying, Arogyam Mahabhagyam. And that is how the last 20 years back, when ISRO has started the satellite-based communication for the telemedicine application, connecting remote and rural hospitals with the district and tertiary hospitals. It was only a proof of concept and a technology demonstration. But luckily, it was supplemented later with multiple other technologies and modes of communication. And thanks to COVID, why I said is, thanks to COVID, whatever efforts the ISRO has done in the initial years, or the Telemedicine Society of India, the professional body which is spearheading the telemedicine awareness and promotion in India, whatever it could not do or could not do, but that was overtaken by the last 18 months, which has brought a real awareness about the telemedicine, the need for telemedicine, and the utilization and usability of the telemedicine. So, the Telemedicine Society of India has always worked for legalization of the telemedicine, and it has continuously put the efforts. And thanks to that, last year on March 25th, the telemedicine practice guidelines were issued by the Ministry of Health, which has brought the fence sitters to adopt the technology. When they said fence sitters in the group of doctors, and fence sitters are apprehensive patients as well. So everybody has officially come into the bandwagon of the telemedicine. And today we call the telemedicine by different names, whether it is a telemedicine, telehealth, digital health, e-health, whatever it is. But the overall picture and the message it is giving is people are adopting the technologies and people are using the technologies and they are asking for more and more technologies. Like in the case of the mobile technology, a dil mange more, that is applicable in telemedicine also. When we used to give less than 1 Mbps, they were asking for 1 Mbps. Now today we are going into multiple Mbps, 100 Mbps or Gbps, but still they are asking more interoperability, more devices, more connectivity, seamless connectivity, everything is being demanded. And as a cycle, they are being provided also. And thanks to the Government of India policy, they have announced the telemedicine practice guidelines independent of any technology. What all it says is the doctor, the patient caregiver or a paramedic can talk to any doctor or one doctor to other doctor as long as they are well connected, they are satisfied, and then they can proceed with the consultation process independent of the technology. And they have also not mandated any technology for the storage of the records or anything. They said that you take enough care to take care of your health, your privacy, patient's privacy, and your security in case of any legal issues, etc. So today, when we talk specifically about the technologies, the advances are the improvements in 3 areas: information, communication, and electronics, ICE technologies. These 3 technologies. And more importantly, the convergence of these technologies is really helping the telemedicine to grow to a greater extent. We know very well that today we are on the verge of 5G connectivity, and we are no longer dependent on the satellite connectivity alone. That is the reason where ISRO is focusing more on providing the satellite-based connectivity to places where there are no other technologies or no other communication methodologies. That is why Siachen in glacier region, the Andaman Nicobar, and other regions and hilly regions where there is no commercial operators or where there is no commercial viability for the commercial people to operate, ISRO is focusing. And then the other technologies are enabling the provision of healthcare when the doctor and patient are at different places. Now the patient can be in Andaman Nicobar, doctor can be in Delhi. Our patient is a army jawan in Siachen Glacier or in the Indo-Pakistan border, but the doctors are in RR and hospital in Delhi. So they are, the place and the geography has become irrelevant because of these technologies. And these telemedicine processes and procedures are being helped and augmented with other technologies in information technology like the cloud computing, and then the data sharing, data mining, and then the IoT of things, where in the Europe we are seeing more aged parents are there, more aged patients are there, where the whole home is enabled with multiple devices and gadgets. So any anomaly, when the patient doesn't pick up a medicine, or when he has a fall in the bathroom or anything, everything is immediately intimated to the family members or to the family doctors. So the IoT connected to a server and the family doctor is enabling the health care to the people irrespective of their location. And the microelectronics, the miniaturization of the electronic devices. Today we have got a visiting card size of ECG machines, and we have got some machines recently innovated which doesn't need a extraction of the blood for the testing of the sugar levels. So that is the innovation, and many more innovations are coming for the miniaturization of the electronics and combining multiple devices into one device so that multiple diagnostic tests can be conducted. And above all these things are on one side, and our mobile phone is on the other side, equal to all that, like a Sri Krishna Tulabharam. What is that? It means all these electronic devices, gadgets are on one side. The mobile phone, which is now more than a computer, which is almost competing with the supercomputer, having many of the diagnostic parameters and features, and a well connectivity. So irrespective of the doctor, that is bringing a doctor. Earlier we were talking like connecting the unconnected. Now the mobile phones are bringing a doctor to the pocket. So doctor is available always in the pocket. Of course, the patients and the people have to use it with care, not to disturb the doctors in any way. So the information, communication, and electronics technologies.
There is a lot more to discuss on this topic. I realize that we have a lot more ground to cover. We'll definitely catch up soon and take this conversation forward. Thank you for your talk today. And thank you to all our speakers today for their insightful and stimulating talk. It's past 12 p.m., our scheduled closing time. So I'm signing off. And now it's over to you, Surbhi.
I want to mention one last sentence. Though we are discussing so much about technology, no technology is a panacea for anything. So only the care, awareness, and compassion using the technology can help the people and the patients as well as the doctors.
Thank you so much, Jisha, and thank you so much to all our speakers for this session. It was wonderful hearing from you. Before we move on, and I'm sorry, I think we've run actually past the time, and we promised in the beginning that it would be crisp and short. Before we sign off, we just have a couple of things to say. There is one small poll that we would want to hear from you. My colleague Shivali will start the poll now. It's for our participants in here. It's just going to take you 2 minutes. If you can just quickly participate in the poll and make a difference. We will hold on to it for another couple of minutes.
Shivali, you have to share the link in chat box, right?
Yeah, the poll is there on the screen, actually. Yeah. Thanks, everyone. Another 1 minute to go. Please put in your responses.
The state of art technology is certainly as a top priority, and then data, of course, there. Better medical research, very, very important actually. I think the first panel, essentially everyone underlined the point about how important the medical research is. Medical research done in India, how important that is. And Dr. Jacob John also essentially made that point in the keynote, and that we need more insight what's happening here, and then accordingly provide solutions. More money, for sure. And the government need to spend more money on healthcare, and we need to make more investments. How are we doing on COVID-19? We are almost like average, excellent, above average, poor. Somehow, I think globally it has been a challenging situation for, I think, every country. So I think nobody can claim that we won or we defeated or we did extremely well. But good to hear how participants think about how we as a government dealt with it. What are the critical top priorities for your organization? Innovation, improving process efficiency, improving employees, cost reduction. Excellent feedback, really good feedback. So maybe 1 more minute, Surbi, before we close it.
So yeah, I think another minute, a few seconds, and then we will wrap up.
It has been a great session. I think the second session was extremely important. I think I see the points made by individual, like thought leaders, CEOs, founders of different organizations are really this is also what we really love often during these summits is people have different solutions, but it is just bringing them together. I know it was very important. I know Dr. Murthy talked about it, how he has been championing the cause of telemedicine. Now everybody is talking about it and trying to do solutions about it. But very important to have all these thought leaders together on a platform.
Great, thank you so much. I think the time's up, and with that, we will close the poll for now. Thanks everyone for participating in terms of being there. The big thanks to all our panelists, all our speakers, and all our participants, our listeners here today for the Zoom session here, and also the ones who are actually following us on YouTube and all other platforms. Before we sign off, just a couple of things in here that I just want to say. Our next summit, which is the Health of India, Telangana and Andhra Pradesh, one is scheduled for 24th of September. It will be really nice if you want to spread the word around, and if you want to reach out to us for any speaker opportunities or any partnership opportunities, or if you may have any questions for today's session, please feel free to write to us on the email ID provided below by my colleague Shivali. Her email ID is here. You can reach out to us for anything for our upcoming sessions, and we'll be happy to get back to you. With that, big thanks from Team Data Leads, Health Analytics Asia, Cruxt, and our partners, SAP and Intellect Brisbane. Thank you so much for supporting us, to all our partners, and hope to see you for the next sessions. Thanks, and have a good day. Take care.
Thanks a lot, everyone. Thanks for joining. I think, I will say one word at the end. No matter how hard the situation is, no matter how difficult it looks like, but I think there's always a space for innovation. I think human mind human body, human brain is good enough capable to deal with a lot of situations. It's just a matter of how we use our, like a strength, how we use our networks, knowledge, expertise, and our own know-how to create solutions. So I think the great companies are the ones, the great organizations are the ones who invest even in difficult situations. And I think the Health of India Summit essentially is to highlight the role different organizations are playing in a very difficult situation and still innovating and creating new solutions, whether use of technology, even in the diet and food for that matter, or bringing, Deepak mentioned about bringing all the stakeholders together on a one platform. So I think we have incredible, space to do a lot of things in India. We have a lot of, we have an advantage of population as well. We can scale things at a very global level. And the challenge often remains how to start the first conversation, how to come closer to each other. And then this is actually the platform for that conversation, to hear you, to understand you, to amplify your voice, so that we have people with a similar thinking coming together and producing solutions which can bring, which can save a lot of lives in the future, which can make us healthy, which can make us, which can make us more stronger in terms of our healthcare infrastructure. So I thank you all on behalf of the team again, and it was a pleasure. Please stay safe, take care of yourself, take care of your neighbors, and see you again in Andhra in next 20 days. Thanks a lot. Thank you so much.
Thank you so much.
Thank you. Thank you. Thank you so much.
In the contemporary world, yesterday is history and tomorrow is full of opportunity. Innovation, transformation, and optimization are the future of industries to achieve excellence in business. Intellect Bizware is a leader in innovation technology and a subsidiary of Neelant Limited. We use a human-centered approach for problem-solving and change management. With more than 14 years of experience in helping companies digitally transform by adopting global best practices and building next practices in industries such as consumer goods, retail, discrete manufacturing, chemical and life sciences. Our solutions help streamline sales, HR, customer, vendor, and employee engagement. We offer pre-configured SAP solutions that drives industry-leading best practices to your business and help you start using in weeks rather than months. We have always been the front runner in driving the SAP innovations. Intellect Bizware has grown to over 400 SAP professionals and more than 200 happy clients across industries. These numbers are rapidly increasing. In our journey, we have seen the following milestones: served the first customer overseas in 2009, won the first Fortune 500 client deal in 2011, served our 100th customer and won top 3 Techno-Savvy SME at the Emerging India Awards 2013, become a subsidiary of Neelant and received the award for EBM Partner of the Year by SAP India in 2015. Worked at pioneer level on S/4HANA with one of the world's first few S/4HANA conversions in 2016. Won the SAP APJ Partner Excellence Award in 2017. In 2018, we qualified the highest number of SAP qualified partner packages on SAP S/4HANA. In 2019, we served our 200th customer. In 2020, we were the SAP S/4HANA Cloud Partner of the Year. Get in touch with us today to embark on a digital transformation journey.
It's been more than a year since the COVID-19 outbreak. The pandemic has created an unprecedented global health crisis. It's time to look back on how our healthcare and life sciences coped with the uncertain times. It's also time to look at the future. It is time to recalibrate. It's time to act. Health of India is a series of high-profile power-packed virtual summits bringing together more than 50 speakers from across India. Throughout these summits, health ministers, policymakers, top CEOs, thought leaders, and technologists will initiate a new dialogue with focus on innovation, technology, and policymaking. Join the conversation as we respond to, recover from, and reimagine the future beyond the current global health crisis. Health of India, time to reimagine the future.